Good afternoon, everyone, and thank you so much for joining us today. I'm Laura Benzel, the Health Equity Lead for iPro. So in today's webinar, we will be discussing how best to prepare for a successful Joint Commission Health Equity Accreditation and/or certification survey. So just a reminder that the webinar is being recorded. The slides and the recording will be available on the iPro website next week, and I'll also be sure to send out a link to both to all webinar registrants. Next slide, please. So iPro leads the CMS QIN-QIO contract for these 11 states and the District of Columbia, collaborating with health-centric advisors and Clarent to ensure high-quality, safe healthcare for more than 20% of the nation's Medicare fee-for-service beneficiaries. Next slide, please. iPro leads the CMS Hospital Quality Improvement Contract also for these 12 states and collaborates with the organizations that you see listed on the slide. They provide technical assistance for high priority patient safety issues in rural and critical access hospitals and acute care facilities serving vulnerable populations. Next slide, please. So the objectives of today's webinar is to provide you with information so that you have a better understanding of the differences between the Joint Commission Health Equity Standards and accreditation process and the optional health equity certification requirements and review process. We'll also share some tactics and tips for a more successful accreditation and review process. We've left plenty of time for questions, so please feel free to enter your questions in the chat. We'll address them after our speaker concludes her presentation. And of course, we'll provide you with some valuable resources. Next slide, please. So I'm very pleased to introduce our guest speaker, Christina Cordero. Dr. Cordero is a Senior Project Director, Healthcare Standards Development in the Division of Healthcare Quality Evaluation and Improvement at the Joint Commission. Dr. Cordero leads standards development projects for new accreditation and certification requirements and survey processes across multiple settings and programs. She's a subject matter expert for several topics, including health equity, so we're really excited to have her join us today. Welcome, Dr. Cordero. Next slide, please. I'll hand it off to you.
Great, thanks so much, Laura. And I'll apologize in advance. I am recovering from a bit of a cold here, so hopefully my voice holds out here. But if we need to pause a little bit to give me a little bit of a chance to have some tea, then we may have to do that as we move forward. So on the next slide, I did just want to provide, as Laura mentioned, an update about the Joint Commission's healthcare equity work that we've been doing over the last several years. I'll talk mainly about the accreditation standards and some tips for survey, and then talk a little bit about our certification program as well. This slide is very difficult to read, but just the idea to point out that we've been working in the healthcare equity space for a long time. Back in 2003, we started to look at our accreditation standards and just start to compare them to some of the requirements and recommendations that were going on at the national level around equity. And over the years, we've had a chance to develop some additional standards and resources to help organizations implement healthcare equity practices and to continue to advance equity in their organizations. And this last year, we've had a very busy year. We announced the launch of our new healthcare equity accreditation standard that I mentioned I'll spend some time today talking about as a national patient safety goal. And then we've also released this new voluntary certification program to recognize organizations that are really striving for excellence in healthcare equity. So on the next slide, I just wanted to walk through the new National Patient Safety Goal. I think many on the call may have seen some of this content in the past, but I wanted to just sort of reiterate what our intent is with these requirements, and then talk a little bit about the kinds of things that you can speak with your surveyor about if you're being surveyed in the next few years around these particular requirements. So the new National Patient Safety Goal is at NPSG 160101, and the goal here is to improve healthcare equity. There's 6 elements of performance within this National Patient Safety Goal, and in the next few slides, we'll walk through what those requirements are and what the expectations are. This was originally released in our leadership chapter. If you've sort of been following the healthcare equity work that we've been doing, we originally launched this in January of 2023 in our leadership chapter, but then in July, we affectionately refer to to it as promoting that standard from a leadership standard into a national patient safety goal. And the intent there was really just to continue to increase the focus on healthcare equity and the priority level of healthcare equity within our accredited organizations across the country. And so we also, in parallel to the development of the National Patient Safety Goal, we also developed a resource center website, which hopefully you've had a chance to take a look at, and I have a link to that site in the slides as well. But it provides a collection of free resources from organizations that have shared their toolkits and different resources and examples of the kinds of things that they're doing to comply with these particular standards. And so we wanted to create a sort of a curated set of resources to help organizations that may have been addressing healthcare equity for the first time, or organizations that have been doing this for a while, but we're looking for other examples, again, of data collection methods or other dashboards that they could use to help with these particular standards. So the new National Patient Safety Goal is applicable to all of our hospitals and critical access hospitals, as well as selected services within our ambulatory healthcare program and our behavioral healthcare and human services programs. And so those are more geared towards organizations providing primary care or physical healthcare, and that have sort of these longitudinal relationships with their patients. As I mentioned, then we released this standard in pre-publication format in January of 2023 as a National Patient Safety Goal, and we've been surveying the National Patient Safety Goal since July of 2023. So on the next slide, just to walk through what's in this particular standard, the content for NPSG 160101 focuses on improving healthcare equity for the hospital's patients and making that a quality and safety priority. So the goal of moving it into the NPSG chapter and really highlighting healthcare equity is that we want to make sure that organizations have that commitment and the vision and creativity that runs throughout their organizations and are dedicating that time to healthcare equity. And so we know in the past, many organizations have focused on equity in some form or another. They may have had pilot programs or grant-funded projects to work on healthcare equity issues in a certain area of their hospital, but the goal of moving it into this chapter and really highlighting the importance of equity is to make sure that these are sustained efforts over time. You know, this isn't just a great improvement that an organization puts forward, but then their grant funding runs out and they really can't sustain it or scale it across their organization. We wanted to make sure this was embedded in our accreditation standards to continue that focus and that emphasis on healthcare equity over time. And so we want to make sure organizations have established leaders and really have standardized standards or standardized structures and processes to help, develop policies and procedures around equity and implement the kinds of things that will help organizations be successful in this area. And we'll point out that we also recommend that organizations integrate their healthcare equity efforts with their other existing quality improvement activities, because a lot of what you'll see in this standard kind of models what some of our other requirements are in the QI space, thinking about identifying a leader, identifying a goal to work on, and then kind of continuing on with that work. And so as we move to the next slide, element of performance 1, the first component of this standard is for the hospital to designate an individual, or it can be multiple individuals, to lead the activities to improve healthcare equity for the hospital's patients. And so the idea here is to establish these clear lines of accountability, have someone that is a champion for healthcare equity issues within your organization, and then to have somebody that has responsibility to oversee the different initiatives that may be occurring across the organization, bring different departments to the table to have those conversations, and it can really coordinate those activities. So one of the questions I put towards the bottom of the slide here is, as you think about your interactions with surveyors, if you haven't already been surveyed about these requirements, is to talk about how your healthcare and equity initiatives are coordinated across your hospital. Who did you identify as the individual to lead your healthcare equity efforts? Why did you choose that individual? Kind of what are their roles and responsibilities? If you're an organization that is part of a larger system, maybe you're doing this at the corporate level and you've identified someone kind of at the systems level, and then how are they disseminating that information and working with individuals that are identified at the individual sites to kind of look at healthcare equity for their particular populations, because certain things I think can be done at the system level, but when you really think about specific patient needs and patient populations, that may differ across the system depending on the location and the demographics of the patients. So just trying to have that kind of conversation with your surveyor about, again, who did you identify as the leader, or what are they doing, how are they coordinating efforts either within one site, one organization, or across the system, if that's how you're set up. As I mentioned, this could be one individual or a couple of different individuals. It can be part of someone's broader responsibilities that they're working on, or it can be their sole responsibility. We know some organizations have healthcare equity leaders or diversity positions that are focusing on these issues. So it really depends on how your organization is structured, but those are the types of things that your surveyor will want to know more about, and just kind of how are you identifying this leadership role in your organization. On the next slide, this starts to get into some of the data collection elements here. We want organizations to start to assess the patient's health-related social needs and to provide information about community resources and support services to meet those needs. And so there is a decent amount of flexibility within this requirement. We are allowing organizations to determine which patients they want to include in the assessments for health-related social needs. You can also identify which health-related social needs you want to assess based on your patient population. So we're not saying that it has to necessarily be food insecurity and housing insecurity and ability to pay for prescriptions. It really can depend on what you as an organization feel is the most relevant to ask about for your patient population. And then which resources you provide to help patients meet those needs, again, depends on where your area of focus is as an organization and what the resources are available in your area. Organizations can ask all patients about their health-related social needs. We know there are organizations that are doing this right now. Or if this is something that's kind of new for your organization, you can focus on a representative sample of patients or focus on a specific area of your organization. So some places are focusing more on maternal health and they're just asking health-related social needs questions from their OB population, or some other organizations are looking at just in the emergency department. And so doing assessments of health-related social needs just on patients coming through the ED. So it really, again, depends on where you are as an organization on your healthcare equity journey and how you want to implement this type of assessment. So when you think about talking to your surveyor about this, they'll want to know how are your patients' health-related social needs being assessed, which patients are you including in that assessment, what health-related social needs are you asking about, and then how do you make that connection with resources in the community to help patients meet those needs. And so again, here, we want organizations to ask about health-related social needs and then also be able to connect patients to resources. In terms of how you do that, again, that kind of depends on how your organization is set up. Some places will have electronic referral systems and they can, refer you to a shelter if you have housing insecurity, and then they can make that referral electronically. Others are handing out, patient discharge instructions and forms that have information about local food banks, for example. And so it really, again, depends on how your organization wants to set that up. We just want to know from a surveyor perspective, which health-related social needs information are you collecting, which patients are involved in that data collection, and then how are you making that connection to resources and what kind of information are you giving to patients to make sure that they know what resources are available. On the next slide, so that's sort of about what are the patient's needs when they come into your organization. Element of performance 3 is really looking at what is going on when they're in your organization receiving care, treatment, and services. And so the goal of EP3 is for hospitals to identify any potential healthcare disparities that are existing in their patient population, and they'll do that by stratifying quality and safety data using the sociodemographic characteristics that they're collecting on their patients. And so again, a lot of flexibility here. We're not prescriptive about which data elements you're using, which metrics you're going to stratify. We're not specific about what sociodemographic categories you're going to use because it really depends on your hospital's patient population. Some organizations have a lot of racial and ethnic diversity, so they'll take one of their quality and safety measures and stratify it by race and ethnicity. Others may see a lot of language diversity within their populations. Some organizations are focusing on age or gender. It really, socioeconomic status, location. It really depends, again, on where you're located, the kinds of things that you want to focus on in terms of disparities. And then our surveyors will want to know which quality and safety metrics did you decide to focus on, and how did you stratify that data? How did you get the information? What did you learn from that analysis? So here again, we have some examples of measures that organizations might want to choose from. Again, you can pick something that you already have prioritized as an organization that you want to look at, but we do say that you can focus on high risk topics, or transplant safety, if you want to look at maternal care, for example, diabetes, or if you want to look at measures that affect all patients. Some organizations are looking at experience of care measures, for example, or trying to look more at communication with patients and try to stratify that information to see if there's a difference between one group versus another. I mentioned sociodemographic characteristics are up to you. Really depends on the type of data that you're collecting and, again, the makeup of your patient population. We want this activity to make sense for your organization. So if you don't have a lot of racial and ethnic diversity, you don't need to stratify by race and ethnicity. We really want organizations to take a look at their patient population and figure out where there may be some areas of disparities. So your surveyor would want to know, again, how did you select the quality and safety data that you're going to analyze? How did you do that analysis, and what characteristics did you include in that stratification analysis, and why? Also, I think organizations, as we've been surveying these standards, have brought up some of the challenges that they've had doing this. I think one of the things that when we first released this standard, there was some questions about, we want to do the stratification analysis by race and ethnicity, but then when we try to pull that information out of our system, it's really difficult to get that information, or we realized that the collection of race and ethnicity data maybe isn't where we want it to be. So there's some potential improvements across an organization to improve that process of collecting race and ethnicity, so that when you go back to do the analysis, it's a little bit easier to pull that information and really stratify your measures by the elements that you're really looking for. So on the next slide, pause for 1 second here. So once you've done that stratification analysis and you identify that you do have a disparity in one of your patient populations, the goal of EP4, element of performance 4, is to develop an action plan. So this is a very similar approach to many of our other standards that we've released in the last few years. You identify something that you want to work on, identify a goal, and then create a written action plan that describes how your organization will improve healthcare equity by addressing at least one of the disparities that you've identified. I will say in element of performance 3, we're looking for organizations to identify one disparity. We know some organizations will run that analysis and identify multiple disparities. And so element of performance 4 allows you as an organization to prioritize what you want to work on. So you pick one of the potential disparities that you've identified and create an action plan around that. I think the number one question that we've received since launching these standards is, does the Joint Commission have a template for an action plan that we have to use? And we don't have a specific template that you're required to use. Some organizations have action plans in place for other QI initiatives and PI projects that they're doing. You're welcome to use something that already works for you. On the Resource Center, we have some examples of action plans that other organizations have used. So if you want to take a look at one of those and build something that works for your organization. But I think the goal is just to focus on what is the specific population that you're going to focus on, or multiple populations, depending on the goal that you select. What is your overall improvement goal? What strategies and resources will you implement to achieve that goal? And I think it's also important to point out, what's the process that you're going to use to monitor that you're making an impact, and how are you going to report progress over time? And so you want to identify all the components of your action plan, but then also how you're going to make sure it's working. Because on the next slide, once you identify that maybe something isn't working, then EP5 is focused on acting when you don't achieve or sustain the goals that you've identified in your action plan. So what revisions will you as an organization make when you identify that maybe you have some room for improvement with some of the initiatives that you are focusing on? So the goal is to be able to assess your progress over time and evaluate whether what you're doing in your action plan is really improving healthcare equity, and are you being successful, or do you need to amend the action plan or potentially add some additional resources or additional training to help with those interventions. So one of the things that you'll want to address with the surveyor is, how did you identify opportunities that you needed to revise the action plan, or that you may need some additional resources? And this really depends, again, on how your organization is structured and what your goal is that you've identified. But some organizations will go back and do that stratification analysis again, right? So you did it the first time to identify disparity, you implement an intervention, and maybe 6 months later, 9 months later, 12 months later, you do that analysis again to see if that intervention is closing those gaps. You may be collecting feedback from patients. Maybe your action plan is focused on improving your language access services, for example, and you've brought on a new language that you're providing interpreting services for, or you're working with a different modality for interpreting services. You can start to talk to patients and staff about how that service is working. Do you need to make adjustments there, make it easier to access, or are there additional languages that you need to bring on to expand those services? The bullet point towards the bottom here about evaluating staff training and education for organizations that may be improving their data collection process, for example. We talked about race and ethnicity data sometimes being one of those things that sort of as a canary in the coal mine, organizations find out that maybe our process isn't where we want it to be. Maybe you find out that you need to do additional training on how to collect that information and sensitively obtain that information from patients. So it really depends on what improvements you'll need to make, really depend on what your goal is overall. So on the next slide, once you've done all this great work and you've had these different implementations and interventions implemented, how are you going to talk about it and share that information with your staff? So the goal of EP6 is that at least annually, the hospital informs key stakeholders, including leaders, their licensed practitioners, and staff about the progress that you're making with these different healthcare equity initiatives. You want to be able to increase awareness across your organization about why you're focusing on healthcare equity, and also bring people into that conversation. And there may be a role for them or their departments in some of these different activities that you have going on. One of the things to think about with your surveyor, they'll ask, how are leaders and staff being made aware of what your organization's initiatives are to improve healthcare equity? And this is your opportunity to really share the kinds of things that you're doing to disseminate that information. We're not overly prescriptive about how you do that, so it really depends on the best ways that you're probably already disseminating information to staff. It can be quarterly newsletters, town hall meetings. Some organizations have their own intranet page on healthcare equity and diversity issues that they share information from. Some organizations have a seminar series focused on equity. So it really depends on how your organization wants to address dissemination of information, and again, what works best for your staff and your teams. So again, we'll just want to hear about what you're doing and how it's working. And then when our surveyors are out and about, interviewing staff during tracer methodology and different things, activities out on the floor, they may ask your staff members, how are you being informed about healthcare equity initiatives, and how's that working? Do you know where to find information if you want to learn more about these initiatives, that kind of thing. So with that, I will pause for one more second here. I think that is the last standard, the last element of performance, the resource center. I'll talk about that for a few minutes here as well. We can go to the next slide actually, and we'll talk about that here. I mentioned we have this resource center. If you haven't seen it, I highly recommend you take a look at it. These are all free resources that are housed off of our Joint Commission site. We didn't really develop most of these resources. These are all from the field, from other organizations that have been doing great work in this area. We just curated them and put them in one place, and we tried to link them as best as possible to the requirements that I just talked about. And so if you're an organization that wants to learn more about collecting health-related social needs, you can actually just go click on a box that says assess health-related social needs on the website, and we'll take you to resources that are just focused on that issue and will help your organization with some of those practices. One of the things that we did is we have snapshots of organizations, like these two-page case studies, 1 to 2 page case studies that highlight organizations that have been, again, working in this area, sharing some of the lessons that they've learned over time and some of the resources that they have. The sound bites are these short videos. So if you prefer to watch a video, we also have some of the leaders from those organizations talking about what they've done, and again, sharing some of the things that they've learned over time. And then the strategies are all these different toolkits and PDFs and resources that we have available to help your organization implement some of these different areas. I can pause for a second. I think, Laura, do you have a couple of questions?
I was just going to say, if you want to take a moment and grab a drink, I just want to let folks know that we are receiving some questions in the chat, and we also received several when folks registered for the event. So what we'll do is address these questions toward the end after Dr. Cordero completes her presentation. And I think we'll have plenty of time to get through all of them. If there are any that we don't address, we'll be sure to send out responses to the questions when we send the link to the slides and the recording.
Okay, thank you. So I think on the next slide is we move into the certification. So perfect segue. So we talked about the accreditation standards and how those are applicable to our hospital accreditation programs and selected settings in the ambulatory and behavioral program. So those are things that are part of our regular hospital accreditation survey. So every 3 years, you'll see those. If you have a survey coming up, the surveyors will start to ask about healthcare equity on all of the surveys that we have going forward. For organizations that want a little bit more evaluation on their healthcare equity initiatives, that are really looking for more recognition in this area, similar to our other certification programs, we did just build a certification program focused on healthcare equity. So this is an advanced certification program that is voluntary for hospitals. Right now, we're only focused on hospital setting, but it is accreditation. You have a separate on-site visit with reviewers that will come to look at some of the requirements that we'll talk about in this section of the presentation. The goal of the certification program is to recognize organizations that are going above and beyond what we just talked about on the accreditation side. So these are organizations that have been committed to healthcare equity for several years, really have put in a lot of those structures and processes in place already, and that are doing some additional work in this area, and they're looking for evaluation of that work, as well as some recognition for their deep commitment to equity issues. What you'll see, I have a couple of examples of some of the certification requirements in the next few slides, but what you'll see is a lot of the certification requirements that we have are kind of a natural extension of what is in the accreditation program. So if you think about that national patient safety goal as kind of setting the foundation for what we want organizations to do in healthcare equity, certification kind of continues to move the field forward and just adds a little bit of extra rigor around some of these areas, has a little bit more prescriptive components in the standards. We're looking for some more specific things on those requirements. And then we were able to also develop a resource center specific for the certification program. So it's a separate website, but those resources are also tied to these certification requirements to help organizations find specific resources to help with implementation, because there may be some things in the certification program that are new for even organizations that have been working for years in this area. They may still find that there are a couple of things in the certification program that maybe they still need to, tie up some loose ends or add some additional specificity to some of the processes that they have in place. Similar to our other certification awards and certification programs like stroke and some of our other total hip and knee, things like that, this is a 2-year certification award. And so our accreditation is a 3-year cycle, certification is a 2-year cycle, and this is a 1-day on-site review by one of our certification reviewers that is, most of them are hospital surveyors cross-trained in this program as well. So it's a separate visit that's separate from your hospital accreditation, but this would be focused solely on healthcare equity. So if you go to the next slide, this is just an overview of what's in the program. I pulled a couple of standards just to give you a flavor of the types of requirements that we have in the certification program, but I did want to present just kind of an overview of the kinds of issues that we're trying to address in this program. So we have a leadership chapter, of course, we always have a leadership chapter, but this is really focusing on organizations making healthcare equity a strategic priority. And the national patient safety goal that we just talked about on the accreditation side, I said it's about making healthcare equity an organizational priority, getting that commitment from your organization as a whole. In the certification program, our reviewers will ask about how this is a strategic priority, how healthcare equity is embedded in your organization's strategic plan, and how the board is involved in the review and discussions around healthcare equity. So again, kind of a similar idea, but just taking it that extra step forward and really looking for those documents for strategic plan and board involvement. In terms of collaboration, there's some elements of this on the accreditation side, making sure organizations are collaborating with their patients and with their communities. But in the certification program, these are specific requirements looking for how hospitals are doing that. So our reviewers will ask about how you're engaging patients and identifying health equity issues that may be bubbling up at the patient level. So some organizations will have patient and family advisory committees, for example. Others have targeted focus groups with specific populations or new groups moving into the area. They may have other activities that they're doing to identify patient level issues around equity. So we're open, we're interested in hearing about, what your organizations are doing in terms of collaborating with patients, how you get that feedback, and then what do you do with that information to improve healthcare equity in general. Same community side, we know some organizations have community advisory groups, or they're working with specific community organizations or faith-based organizations. They already have those inroads and those relationships established. And so the goal of these requirements in this chapter is for the reviewers to be able to understand how you're working with your community, how those established relationships give you information around healthcare equity at the population level, and then how does that impact what you're doing as an organization to address equity. So again, just trying to dig into these issues a little bit more on the certification side, but many of them tie to some of the foundational things that we have on the accreditation side. Data collection, so there's a whole host of requirements around data collection, a little bit more specific, again, because it's certification. Want to know about how organizations are looking at their community level data, what they're collecting from staff, and what they're collecting from patients. And I think I pulled a couple of requirements there, so we'll talk about that in detail. Provision of care, there's a lot of things in this chapter, but again, looking at how organizations take the data that they're collecting and how do they infuse that into their systems of care. How are they looking at workforce diversity? What type of training are they providing for staff to kind of address different healthcare equity issues, looking at disabilities and health-related social needs in a little bit more of a prescriptive way. And then the last chapter here on the right side of the slide is focused on performance improvement. So how are organizations taking the information that they're collecting and looking at their services, and what are they doing to improve their services to make them more equitable to all their patients? And then what are they doing with the data that they're collecting from their staff to improve some of the work that they're doing internally on diversity, equity, and inclusion? So on the next slide, I just pulled a couple of examples of this program. Some of the requirements here on a community level for data collection, the requirement is that the organization reviews data about the community that they serve to identify opportunities to improve equity. So here again, looking at how the organization is looking outside their own data collection, well, the walls of their hospital and their own data collection, to get a better idea of what's going on in the community. And so reviewing data about the sociodemographic characteristics and health-related social needs of the individuals within the community. A lot of organizations are doing community health needs assessments. So this fits quite nicely under this type of requirement. Some will be looking at available data sets at the government level, public health data, local and state data. So this is just about trying to take a broader look at what's going on in your community, and that may help inform some of the work that you're doing internally as those patients come from the community and come into becoming patients in your organization. On the next slide, on the patient level, we talked a little bit about some of the flexibilities that we have on the accreditation side. On the certification side, we're a little bit more specific about data that's being self-reported by all patients. So these are the types of data elements on the certification side that we would be expecting to see from all patients coming through your doors. Race and ethnicity, we have some additional information about collecting granular levels of ethnicity. So say you have a large Asian population, for example, you might want to think about collecting some additional information within that population to better identify how many patients are Chinese, Japanese, Filipino, etc. So things like that, where we want organizations to start to think about their patient population and maybe have some additional data elements that they start to collect. We've always had a requirement to collect preferred language, but here we also added not just that we want to know what the patient's preferred language is, but also do they need an interpreter? And if they have an interpreter or they're provided an interpreter, if they need interpreting services, that you would document that interpreter use as well. So again, trying to add a little bit additional level of detail for why we're collecting this information and what the organization can use that for. Health-related social needs, we talked about this in the NPSG, that there's some flexibility to determine which health-related social needs to collect for accreditation, but for certification, we're much more specific, and there's actually a list of bullet points and components that need to be included in that health-related social needs assessment. So we're looking for housing instability, food instability, things like that. So they're listed in the EP itself, and they align nicely with the CMS attestation measure in this area as well. One of the newer components of data collection for patients in the certification program is looking at physical, mental, communication, or cognitive disabilities that require accommodation and what that accommodation is. And so many organizations have collected this information in the past, but we really wanted to put this into the requirement to make sure that this information was being collected from all patients. So any organization that's going for certification should be able to demonstrate how they're capturing that type of information on disabilities and what those accommodations are. And then we added a component here about incidents and perceptions of discrimination and bias that are experienced by patients, because we want to have a mechanism for organizations to be able to identify that information and then use that for performance improvement. On the next slide, this is the staff level data. So I think this is one of the newer components of this particular program. We typically don't ask organizations to collect information directly from for healthcare equity purposes. I mean, it really is important to understand the diversity within your staff as well. And so this requirement focuses on collecting self-reported data from staff and leaders within the organization to help identify opportunities to improve equity. And so we are requiring certified organizations to collect race and ethnicity information from their staff, as well as any languages spoken, and then any incidents and perceptions of discrimination or bias experienced by staff. So parallel requirement, we want to know what's going on with patients in this area, as well as if your staff are experiencing these types of incidents, we want to have a mechanism to collect that information and use that for improvement purposes as well. On the next slide, I think this is just a snippet of one of the requirements around staff training. So this is in the provision of care chapter. We want to make sure that organizations provide staff with education and training necessary to address some of these different equity issues. And so we've always had requirements in the accreditation manuals about providing staff training specific to job responsibilities. We always want to make sure that staff have the appropriate education and training necessary. In terms of equity, what we included here is that we want organizations to provide information about the organization's overall rationale for improving healthcare equity. So why is this a priority for your organization, and making sure that everyone kind of gets that same message across the organization. Some places have, again, been doing this type of education for a long time. So maybe they're at the point where they're doing implicit bias training or that kind of more in-depth type of work. Other organizations may be focused more on the impact of health-related social needs and health disparities. Some are looking at the history of racism in healthcare, or maybe within their own communities or the areas that their hospitals are located. So it really depends on, again, where your organization wants to focus, but we just want to make sure that there's consistent education going out across your organization about why you've taken on healthcare equity as such a priority issue, and make sure that you kind of level set across your entire staff. For any staff members that are collecting that patient level data, we talked about there's a lot of data elements there. A lot of those are sensitive data elements. We want to make sure that individuals that are tasked with collecting that information have training about how to sensitively obtain that information, scripts about how to ask for that information, and how to explain to patients why you're collecting that information and what you're going to use it for. So we know that sometimes those are, again, sensitive data elements. We want to make sure that everybody understands why you're collecting that information and why it's so important. And then any individuals that are working and communicating directly with patients and families that have language needs, we want to make sure that there's some sort of education and training provided around how to access and work with interpreters, how to use auxiliary aids and services for patients with communication disabilities, just so everybody has the information that they need to be able to provide services to help improve communication. On the next slide, this one is about health-related social needs. So we talked a little bit about what is on the accreditation abilities there in terms of how you collect this information and from whom you're collecting this information. On the certification side, this is information that we are expecting to be collected from all patients, and we want organizations to review the patient's health-related social needs to determine if there are modifications to the plan of care. So not just to identify that the patient has food insecurity and connect them to a food bank, but also to think about how food insecurity may be affecting the patient's care plan. So for example, if you have a patient with diabetes, but you also know that they have food insecurity, that may affect the way that you put together a plan for how you'll have tight control of their diabetes. So again, just trying to incorporate some of the information that you're collecting into how you're providing care. There's also a component of this requirement about collaborating with community and social service organizations to address health-related social needs. And I think on the certification side, we're looking for a little bit more of an established relationship with some of these organizations. And how are you making sure that your referrals to the local shelter or the local food bank can be met by those organizations, or you're not sending too many people to one organization versus the other. And so there's a number of different ways organizations can show the reviewer that you're having this collaborative relationship, but we just want to start that conversation and hear more about how hospitals are working with these different external organizations to help meet the health-related social needs of their patients. On the next slide, I think we start to get into some of the PI requirements here. So this is, I won't go through all of these, but this is just, again, an example of some of the requirements that we have around performance improvement for certification. So asking organizations to take a look at the sociodemographic data of their patients and look for missing or inaccurate information. So this is where you start to identify areas that you might want to improve in that data collection process. You see a lot of missing answers, or people are selecting the wrong race and ethnicity, doesn't match up with the patient. That information, if it's not accurate at that point, it's not going to help you in the stratification analysis later on. Looking at data from your complaint resolution process, so trying to identify potential incidents and perceptions of discrimination and bias, or anything else that may bubble up through that complaint process to identify areas to improve healthcare equity. The last bullet here on this slide, stratify at least 3 quality and or safety measures for your organization's priority clinical conditions. So you're looking at diabetes, for example, maybe you focus on maternal care. We have some examples of things that organizations can do, or you can look at what's in your healthcare equity strategic plan. But the idea is that the reviewer will want to look at the analysis that you're doing of at least 3 quality and safety measures, which is a little bit more rigorous than what we have in the NPSG. On the next slide, this is the staff side. So you want to do PI activities to figure out how to improve your services. We also talked about the information you're collecting from staff and how you can use that to improve your own internal work that you're doing. So this is about identifying improvements on the staff side, comparing the race, ethnicity, and the languages spoken by your staff and leaders, which is that data element that we talked about collecting for this program, and then comparing that to the race, ethnicity, and the preferred language from your community, and looking for opportunities to increase concordance across those data elements. It may not be something you can do overnight, but just looking for opportunities to continue to move in that direction. And then if there's a way that organizations can start to stratify culture of safety data, or maybe you're looking at your own employee opinion surveys, using those data elements of race, ethnicity, and language spoken by your staff to identify opportunities to increase diversity or look for improvements around equity and inclusion, again, within your own organization and some of the work that you already have ongoing. So on the next slide, this is about the Resource Center. So I mentioned separate website. If you go to the Joint Commission main page and you look at healthcare equity, you can get to both of these places. But just to point out the Certification Resource Center, we separated the resources by chapter. So those big domains that we just talked about, and you can go to an entire set of resources focused on collaboration to look for resources about collaborating with communities or how to work with patients directly to identify some of these different equity components that you may want to incorporate. There's a whole list of strategies similar to what we have on the accreditation side, as well as some spotlights, and they're still doing some updates on the website here. So you may see some new content pop up from time to time, but our research team was able to go and do some interviews with a number of different organizations, again, leading in this area, to try to pull out some lessons learned and some information that those folks can share with your organizations about some of the challenges that they've encountered and some of the different tools that they've used to help overcome those barriers. So on the next slide, I think we're nearing the end here. For more information, this is the website for the certification program. If you're interested, again, this is a voluntary program, but if you go to that link, it will get you to access to the standards, and you can get some information more about sort of the application process. And then we also have an on-demand webinar recording. Full disclosure, it is just me talking about these standards, but it kind of goes in depth across the entire certification program, talks about all the standards in that program, walks through what we're looking for. And then there's also a live demo of the Resource Center in that webinar as well. So that might be helpful to the folks on this call, or if there's folks within your organizations that you think might want a deeper dive on that certification program, I highly recommend you take a look at that as well. So with that, I will take another coffee break and turn it back over to Laura.
Yeah, thanks so much, Dr. Cordero. That was so great, very comprehensive, and we hope that you're able to see the difference between the health equity requirements and standards and accreditation and the certification program. So I put a number of links in the chat. They'll also in the slides, and we have been asked a few times about the slides. We will be sending a link to the slides in the recording, which will be posted on our website next week. So we did receive some questions, and we will Wait for Dr. Cordero to come back, and then there she And again, thank you for doing this when you're not feeling in tip-top shape. We really appreciate it. So um, the first question is in the chat. It actually has a few parts, so I'll start with the first question. How are organizations finding populations that are statistically validated to fall into the DEI standard?
So it sort of depends. I mean, I think we don't have a requirement that has to be statistically significant difference if you find disparities. It's really just about trying to do that data analysis to look for any differences that you see in one population or another, and then trying to prioritize as an organization where you want to put that focus. And so it doesn't necessarily have to be a huge disparity, or if it's just something that you as an organization want to work on in terms of just improving equity, or an issue that you know nationally is something that is a disparity and you just want to take a deeper dive in that area, then you can have that conversation with your surveyor that you did the analysis, you stratified your patient population by a certain sociodemographic category, you did it on a certain metric, and you didn't see a huge difference, but you still feel that this is something that you want to focus on and you want to continue to improve care for one population over another, or for your entire population, but this is something you want to look at, then that's a kind of conversation you can have with the surveyor, that you did what is in the standard, and you look for a difference, and maybe the difference is subtle, but this is what you're going to do, and this is how you've incorporated that into your action plan. Because again, we know some organizations, ideally, you would run the stratification analysis and you don't see any difference. But we know some organizations will see varying severity of those gaps. But we just want everyone to start to get into their data and look for those differences, and then to see what you want to prioritize moving forward.
So I think you mentioned previously that if an organization is in an area where there's not a lot of diversity for race and ethnicity, there are other ways that they can identify disparities. And I think that's the second part of this question is, does the Joint Commission identify disabled populations within DEI for focused intervention?
Mm-hmm. Yeah, I mean, we're not overly prescriptive about what those different demographics categories that you use to identify disparities. If you are tracking disability already, and there's a way that you can stratify your data by disability status, then you could do it that way. We encourage organizations to look at age or gender. There's some certain metrics in cardiology, for example, that we know women have different performance on than men, so there may be some gaps there in the female population. So it really just depends on, again, what your patient population mix is and sort of where you want to focus. So it doesn't necessarily have to be racial and ethnic disparities. It could be socioeconomic status as well, but different ways to look at your data to identify where there may be some opportunities to improve for one population over another.
We do have another question in the chat. In regards to certification requirements, data collection is for all patients, not just a certain group that we identify, correct?
Correct. For certification, the data elements that I put up on that slide are for all patients. For accreditation, many of those elements are for all patients as well, but health-related social needs was the example that we used today. Health-related social needs for accreditation can be for a focus group or a certain area of the hospital, but for certification, we are looking for that information from all patients.
So one of the questions we received from someone who registered, when they registered, it said, would love to hear how clinics can tie their efforts into supporting local hospitals in gleaning data and engaging in equity practices.
Yep. So there's some, from a system perspective as well, there's some organizations that have both hospitals and clinics, and you're all grouped together, and you have data collection where some of the health-related social needs are being collected at the clinic level and not necessarily at the hospital level. And so I think from that perspective, as long as that information moves with the patient throughout your system, if it was collected at the clinic level and it moves into the hospital with that patient, you don't necessarily need to collect it again. We just want to make sure maybe nothing has changed over time. So sometimes, again, health-related social needs or disability status may change over time. So you want to kind of make sure that what was collected in the past hasn't changed dramatically, or that patient doesn't want to identify additional needs at that point. But some of that information, depending again on how your organization is set up, can move with the patient from different settings and still help to show compliance with these requirements for the hospital certification.
Great, thank you. I know you covered this in the slides, but just to reiterate, we did get the question, will the certification process involve submitting documentation, or will this be a site visit? And I believe you responded, it's both.
It's both.
Is that correct?
Yep.
Yeah, and And it says, if a site visit, is it announced or unannounced?
For certification, so this is where the ops team is better at these questions than me, but I think for an initial, you get to put in a ready date, and I think there's some information that you're getting in advance, but the certification reviews are typically unannounced, I think, or I can check with the team before I misspeak on this, since I know I'm being recorded. I don't want this to live on forever. I think you might get a little bit of notice for certification, but I can double check and get that information back out to you. But I think in terms of just the question about uploading data, there is some documents that we would have you upload to a SharePoint site, similar to some of the other processes that we have in place. The biggest difference with this certification program versus some of our other cert programs, if you might be familiar with, is that we don't have performance measurement embedded in this program. So you're not uploading measures to our CMIP site, if that's something that is familiar to you. This program doesn't have that component in it at this time. So you would upload some policies and some other information in advance of your review date, but we don't have that same kind of embedded performance measurement upload data that we have in some of our other programs. So that's one key difference, but I will make a note about the announced review and the announced review, and I'll circle back with that, because I want to say that typically they're unannounced, but I think for an initial, for a first time visit, you may get a little bit of an information in advance.
Okay. Someone did put in the chat, for stroke, palliative, and heart failure, we were given exact dates.
Okay.
So
Yeah.
it may
more about that than I do.
Another question in the chat: Massachusetts hospitals are mandated by Mass Health to obtain certification by 2025. What is the plan for these organizations that are due for triennial survey in 2025? Will there be an additional surveyor for this certification in addition to this survey team?
For certification, it's a separate visit, so it is a different reviewer, and they typically don't group them together for any of our certification programs. So if you're certified in stroke and you have a hospital triennial survey going on in the month of June, for example, they don't necessarily tack on your stroke review at the same time either, because I think typically, well, sometimes that sort of makes sense, because then you just have everyone being evaluated at the same time. I think they try not to do them together, just because I think it's just so much, it may be just disruptive to the organization, because there's just so many people involved in those reviews. So if you're an organization that has your triennial end in 2025 and you're also going for certification for healthcare equity, those would be separate visits and separate teams. The hospital survey team is one group of folks, and then a couple of those hospital surveyors are cross-trained to do healthcare equity, but that equity review would be a different day, and the equity certification review is a one day.
Great. Thank you.
Mm-hmm.
Another question we received is, which care settings are eligible to apply for the health equity certification?
Right now, the certification program is focused just on the hospital setting. So any organization that is a hospital or within the hospital's CCN number is part of that hospital. But I don't know if we'll expand it in the future. We've had some conversations about that, but nothing, don't quote me on that. I'm not quite sure where we'll go with it, but right now we're focused on hospital. And I will say we've seen a lot of good uptake of this program. I think our business development teams are really excited about the level of interest in this program across the organization, even across systems. So when the business development teams are happy, usually that's a pretty good sign. But we have had a lot of interest in the program, just because I think organizations have been focusing on equity for a long time now. And I think that, again, those organizations want to be recognized for that work and want to sort of see how they stack up against these new requirements. And then to be able to say that not only did their accreditation survey grow really well around healthcare equity, but that they have this additional recognition for the commitment that they've made.
And it's timely, because now we see CMS having some measures around health equity that are, one was required for this year, the social drivers of health is required next year. So, and I believe you mentioned that you work together with CMS to try to make it as compatible as possible, so hospitals there's not additional work that they have to do to meet the requirements. Did I state that correctly?
In the requirements we have for certification around health-related social needs, we at least wanted to maintain alignment. So we didn't have anything that was in opposition to what they were looking for, but we did kind of want to we're all going in the same direction with that. So we wanted to make sure that what we're requiring for certification for health-related social needs does align with what CMS is looking for as well.
So based on accreditation surveys that have been conducted so far this year, are there any health equity requirements or areas that you're finding that organizations are finding especially challenging?
I would say probably the just doing that stratification analysis. I think for some organizations, again, if you've been doing this for a long time, your data collection on race, ethnicity, and language, and some of those other sociodemographic characteristics is a machine, and you've been doing it for a while, so you're able to kind of pull that information out and do that stratification analysis fairly easily. Other organizations where this is a bit of a newer topic for them are finding a little bit more, hiccups along the way of how to collect that information, where they're putting it in their electronic records, how they're getting it back out to kind of do stratification analysis. So I think that's where some of the challenges that organizations started to run that analysis and found that maybe their data collection process needs to be improved. And so maybe that's the first thing that they're going to work on. And that when they rerun that information, that they'll be able to learn a little bit more from the data itself. But I would say that's probably the questions come through most about that. And then we have a lot of questions, like I said, on sort of templates for action plans, templates for collecting health-related social needs, assessment questions to use. And so the Resource Center does have a number of resources about those types of things. So organizations can either pull down those tools and use those as is, or modify them and tailor them to your personal population or your organization's population.
Yeah. That's actually the last question is regarding the action plans. You did describe that resource and you did mention you have a template, and I noticed that the CMS Disparities Impact Statement was on your website, and that does have a template for an action plan. There are many different templates out there. So I did put the link in the chat, and everything that Dr. Cordero mentioned today as far as resources, the links are in the chat. They will also be in the slides when we send those out. And I just want to say thank you so much for joining us today and enduring this with a cold. We really appreciate it. That concludes our webinar for today. We did get through all the questions. We just have the one that we have to clarify, and we'll send that out when I send the link with the slides and also the recording. So thank you so much, everyone, for joining us today. Have a great holiday. And again, thank you, Dr. Cordero.
Absolutely. Thanks, everybody.